Police have confirmed the 40-year-old man behind the attack in Bondi at the weekend suffered from mental health issues. It's turned attention onto Australia's mental health system and how effectively it supports sufferers. Consultant forensic psychiatrist Professor Kimberly Dean says more work needs to be done.
It certainly can be the case that people with severe and complex mental health conditions like schizophrenia do find themselves in very difficult circumstances, including being homeless and living that kind of lifestyle, perhaps with other sorts of problems, substance use problems, and having contact with the police. It's not the majority of people with severe mental illness, but there is a significant minority who find themselves in those circumstances.
How difficult is it generally to treat people with severe disorders like schizophrenia? We know that officers had performed a check on this man last year. Do some people resist treatment? Does their actual mental state change quite quickly as well?
It is a challenging condition to treat. It is treatable. We have biological, psychological and social treatments for schizophrenia. Many people benefit from those and do very well. But for some, particularly those with severe and complex and other comorbid problems, it can be very difficult. And one of the hallmarks of severe psychosis can be lacking the awareness that you need treatment and that you need support and services. And some people are actually so unaware that they are actively avoidant of help. So that does complicate treatment for those in that circumstance.
And usually, do people suffering from this have just the one condition, or are there usually multiple conditions at the same time? For example, drug and alcohol abuse as well.
It's not uncommon for people with severe mental illnesses like schizophrenia to also have other mental health and social and even physical health conditions. That's not uncommon, and certainly at the more severe end of the spectrum, problems with drugs and alcohol are very common.
It's very hard at this early stage, of course, to say what could or should have been done to make a difference in this Bondi case. But broadly in Australia, do you think we're doing enough to help people with complex mental health issues?
I don't think we are. I think in Australia, just like a lot of places around the world, we haven't fully addressed the scale and the complexity of these problems for people. I think it's challenging, as we've just described, but I think we haven't had sufficient investment from governments of all sorts into care for this group of people. It needs to be comprehensive care. We need a whole system from community to, enough inpatient beds. Too many people with severe mental illnesses are finding themselves in difficult circumstances, and many in contact with the justice system. I think there's also real difficulties in recruiting and retaining staff. We're facing a crisis in the mental health workforce at the moment.
And so just to flesh that out a little bit more, what could actually be done to improve the situation now? Is staff retention the most pressing issue, or is it simply beds?
I think it's a combination of things. Mental health care, like mental illness itself, is complex. And we have a healthcare system that's designed for acute healthcare needs. So this is not just true of mental illness. Other areas of physical healthcare, the pressing needs are chronic health conditions, chronic relapsing health conditions, and that's true for mental illness. So we need services that are set up to support people who have long-term and complex problems and will occasionally need urgent crisis-type intervention. So it's a systems-wide approach we need. And I do always find myself thinking when new initiatives are announced, new funding is announced, which is very welcome, that at least at the moment, it's very difficult to see that investment and funding being fully utilised when we have such difficulty with recruiting and retaining staff. We really need a focus from governments and partners across mental health to look at all the different ways that we can attract people into mental health work and to retain those staff when we recruit them.
All right, Professor Kimberly Dean, thank you so much for speaking to ABC News this morning.
Welcome.